Okay, great. Hello and welcome everyone to the South Orange Public Library's Fall Lecture Series, Special Conversations with Special People. I'm Laura Sims, the moderator for the series, and I'm very excited to have Andy Lehren with us today. Andy is a senior editor for NBC News Investigations and director of investigative reporting at CUNY's Journalism Graduate School. At both NBC and as a former New York Times reporter, Andy has worked on a range of national, international, and investigative stories. In his award-winning stories, he has covered topics such as the pandemic and economic relief efforts, the WikiLeaks trove of diplomatic cables, substandard Chinese chemicals tainting US pharmaceuticals, and hidden trails of money laundering and international sanctions evasions involving US banks. He has also covered major hurricanes, the BP oil spill, Olympic sports, mining disasters, 9/11, terrorism, racially based policing, and many other events and topics through the years. It's totally overwhelming, all of the topics that you've covered, Andy. Andy has lectured for Special Conversations several times. In 2010, he spoke about jazz and the FBI. Later, in that same year, he spoke about WikiLeaks. Then in 2012, he discussed his international investigations for the New York Times. With his numerous awards, such as Peabody's, Emmys, and Investigative Reporters and Editors Awards, and his extensive experience as an investigative reporter, I'm so pleased to welcome our special guest, Andy Lehren, to talk about his latest investigations. Thank you so much for being here, Andy.
Thanks so much, Laura. It's always a pleasure being here with everyone at the library. As as you and many may know, our family holds the library near and dear to our hearts. My wife has done music programs there. My son did his Eagle Scout program with the South Orange, his Eagle Scout project with the South Orange Public Library. My daughter also loved it. So the library holds a very special place in our hearts. So thank you so much.
That's great. That's great to hear.
Yeah. I know we have a few people on the line, so we'll definitely have time for questions. And I know that in the past, the way we've kind of done this is to just talk about some recent stories that I've worked on. And what I really like to talk about is how we go about doing these stories, the effort that goes into them. I guess to explain a little bit about what it takes to do in-depth reporting. Those of us who are in the business, can be terribly familiar about how the sausage is made. And I just really I always enjoy trying to explain to people, because they may not realize like what it takes to do some of the stories that we do. So
Right, that sounds great.
Great. And I know that I can share my screen, so I will begin what hopefully will not be too turgid a PowerPoint. Let's see if we can get this right. Okay, great. And we'll begin. Beginning. And you should see this, I would imagine, right?
Yes, we can see it.
Great. So, like all of us, we certainly became aware of the pandemic back in March of 2020, which is, I guess more than 18 or somewhere around 18 months ago. And I wanted to talk a little bit about some of the stories that we've done on the investigative desk at NBC News. And just to provide some context, as everyone I'm sure can imagine, we're a very large news organization. So we have a lot of people doing a lot of different stories. So when I talk about my stories, it's not to say that we weren't providing similar horsepower to covering other aspects of the pandemic. I just want to talk a little bit about how we tried to fit in and do additional work and add to our coverage through the investigative desk. So if I could bring everyone back to what it was like back in March of 2020, were we aware that pandemics might be possible? I mean, of course, it doesn't take much imagination to walk around, say, the streets of Philadelphia, where I lived for 10 years, and see signs about, yellow fever, or to have read a lot about the influenza pandemic of 1919. It doesn't take a lot to recall some of the past pandemics. So are we aware of it? Yes. Did we have like some written game plan as journalists about how we would cover it? No, not that I know of. Maybe on the medical desk, there was some talk about that. But whenever we do investigative stories, we do have techniques and methods that we use to go about approaching a subject. And part of it is that we're always looking for ways to add to coverage. So when we're doing investigative stories or enterprise stories, it's to say, okay, we know that these kinds of stories are being done by our colleagues. We'll trust that they're being done thoroughly and quickly. What is it that we can add to? So to go back to March of 2020, we of course are having a lot of discussions. What is coronavirus? What is, are people getting sick? Where are outbreaks occurring? So all this kind of, and of course the political ramifications of the pandemic were also beginning to unfold. So when we're examining what we can do, we're trying to figure out like, well, what is it about our skills as investigative reporters that we can add to the discussion? So one of the things that I'd like to think that we as investigative reporters are good at is following document trails and looking at what we can actually track. So things that we might be able to measure or document. And if that could involve going through government records, through medical records, talking with countless sources. So how does this translate into stories? So first, I just want to talk about some of the stories we did just in the opening weeks of the pandemic alone. One of the things we did is, we can look at documents like lobbying records. So how are people lobbying the federal government with the pandemic outbreak? And what we found is within 2 or 3 weeks, there were countries around the world that were lining up American lobbyists to represent them in Washington and lobby for special treatment, for trying to enhance their reputation, and for other things. So we found just by going through lobbying records that countries like Saudi Arabia, like Japan, and others were quickly lining up lobbyists. To document this, we used government lobbying records. They're kept by the Department of Justice. When you want to see whether any country is lobbying the United States, you can go through Department of Justice filings. It's kept at the Foreign Agent Registration Act website. So this is one of those things where journalists do not need to file Freedom of Information Act requests to get the information. We can actually get it relatively quickly, but of course, part of our job is to make sense of these documents. So here are some of the lobbying records you could see by the governments of the Philippines, Liberia, all sorts of documents are being filed. And then our job is to try to not just see, oh gosh, there's hundreds or thousands of documents, it's to make sense of them. So that's what we worked very hard to do for this lobbying story. So this we turned around relatively quickly. And I worked with my colleague who covers the State Department, Dan DeLuce, to do this story. We found countries, for instance, like trying to, pressure the Trump administration not to instill travel bans, things like that. So those are some of the ways that government policy lobbying was taking place. But of course, with the pandemic, there was far more than just that. One of the other things that, again, go back to March of 2020, we were beginning to hear dribs and drabs from, anecdotal stories from a nurse or a doctor that there was no protective equipment in place. There was no plan in place at many hospitals. There wasn't a big warehouse of supplies to help them deal with outbreaks like this. And while we were seeing anecdotal stories, we wanted to go bigger and try to do a national story. And so one of the ways we did that is this is again in the first day or two of the pandemic seeming to be a pandemic. So we're talking about March 8th or 9th of last year. I I put together a survey where we could begin to reach out to medical professionals to hear from them and hear what their stories were. And we used social media to push out a survey to medical professionals. And we also asked medical associations to help push out our survey to their professionals to hear what they had to say. This is kind of what the survey looked like from our end. And this was pushed out via social media. And of course, we focus on particular questions like, has your medical setting taken precautions like sanitation and minimizing exposure? Are you being asked to work with COVID exposed patients without proper medical equipment? Can you tell us more about this? We get the survey results back in a spreadsheet, but the key part is that it gives us names and contacts. So we then, a team of us interviewed medical professionals around the country, and allowed us to do what I think might have been the first big picture story in the country about the lack of care and about the lack of protective equipment that our medical professionals face. So it's one of the ways we went about looking at what was facing the medical profession. At the same time, of course, people were beginning to die. So along with infections, there were deaths that were beginning to be documented. And we wanted to take a big picture look at that. And we teamed up with some of our colleagues to essentially put together a database of all those who've been dying across the country. And it wasn't just us, there were other news organizations across America doing similar things. One of our first big efforts to look at those who were dying from the pandemic was this that we did, after the first 2 months of the pandemic, 60 lives in 60 days, a look at the victims who died from COVID. So this was by tracking death records across the country, and then trying to help people realize that these were not just statistics, but these were people ingrained in the fabric of our communities across the country. So we worked really hard to try to personalize and bring to life what otherwise might seem like just statistics. For myself, one of the stories that I, along with helping put this all together and oversee the project and help go through some of the statistics, was telling the story. So for those of us here in South Orange, one of the stories that I wrote up was about Wallace Roney, a jazz trumpeter who just lived a couple towns over in Patterson. And for those who don't know, Wallace had actually performed in South Orange at SOPAC, and John Lee, the great jazz bassist who lives in town, he puts together Giants of Jazz, almost every year except for the pandemic, as a great tribute to the performing arts here in South Orange. And I sometimes volunteer and help out John from time to time. And one of the remits he gave me several years ago was to go and get Wallace. So I drove over to Wallace's home and drove him back over here to SOPAC so he could perform. It was a sad task to write Wallace's obituary for NBC News, and in this you'll see that I quoted John Lee. So that's a South Orange connection to one of the projects that we did. We also wanted to give our readers and viewers a big picture look at the pandemic, and one of the ways we did that was by essentially cracking open the history books and then reaching out to people in previous administrations, the Bush administration, the Clinton administration, the Obama administration. So we looked at 20 years worth of government policies that were put in place to deal with pandemics and how they waxed and waned. And one of the things we did is we also followed the money. And that's one of the things we do as investigative reporters. And we could see how, budget decreases occurred during the previous decade, but also how planning preparedness had, that had been in place in previous administrations was not given front and center priority in the current, in the Trump administration. So we were documenting that as well. We also looked at other things that we thought were interesting, which was that in the opening weeks of the Trump administration's handling of the pandemic, there were a lot of regulatory rule changes that were taking place. But and a lot of them did have to do with the pandemic. But what we also noticed was that the administration was using the pandemic as a reason to do things that seemed totally unrelated to fighting the coronavirus. And one of the things we saw by going through regulatory filings, we saw that the Trump administration was rolling back environmental rules, changing the way immigration courts were functioning, and other things that seemingly had little to do with the virus and the pandemic. So how did we do that? We combed through the Federal Register, which is the government's daily filings of regulatory rule changes. And we literally tracked hundreds of rule changes just in those opening weeks of the pandemic to see how those rule changes were taking place and how many related to coronavirus and what did not. So one of the things we do as investigative reporters is we'll look at, like, what does the government say it's going to do and what does it really do? So in the early weeks of the pandemic, the Trump administration said, if you have coronavirus, don't worry, go to the hospital, get treatment, the government will take care of your medical bills. And what we found, and I think we did this story in April, just within a month or so of the pandemic opening up, is that was not really happening. That there were parts of the country where insurance companies were fighting these kinds of proposals, and there were patients getting hospital bills for thousands of dollars despite this promise. So to do this story, we literally were tracking legal efforts by the insurance industry. So a really squirrely way of going through documents, but you would see that in the insurance industry, there was a lot of legal pushback, and we could track that pushback and then talk with patients who were facing those big bills. And then in addition, we followed the money. And one of the ways to follow the money at the federal level was the CARES Act. So you might be familiar with this. This was the big legislation that was put forward to provide pandemic economic relief. Perhaps its biggest program was the Paycheck Protection Program, but there were a lot of other ways that money flowed out of the CARES Act. It would flow through the Department of Education or HHS or other government agencies and the Department of Transportation. So our job was to essentially develop a checklist to see, like, where's the money flowing, which agencies are handling it, and how can we best track it. So the CARES Act was about, it was almost 150,000 words. So that's like reading 3 books. You can easily see any legislation you want on the government's website. So we went through this legislation and bit by bit sorted out how the money was flowing. So I'm going to talk mainly about the first tranche of pandemic relief, the CARES Act, but there have been other tranches of that money. But to explain how we go about doing our stories, this will probably be a good enough object lesson. So one of the ways that money flowed out was to schools. The Department of Education meted out money to colleges, but it was really tricky to follow. They did not provide a lot of information. We did not need to file a FOIA for it, but we really wanted to learn more about what kind of schools were getting this money. And the world of education is really interesting because it's pretty well documented, who goes to schools, what's their background, their economic background, their demographic background. What do they study? How much does it cost? Education is something where it's kind of robust, where we can learn about how things work. But the Department of Education was not giving us a lot of information about who was actually receiving the loans, aside from their names and a weird ID number that didn't do us much good. So we had to figure out ways to learn more, to go bigger. So we started going through that. And what we realized was that when it came to the CARES Act, a lot more money was going proportionally to private for-profit schools than was going to, say, public community colleges, which is considered the bulk work of our nation's, post-secondary education effort. So community colleges is where you think a lot of money might have gone because that's our public institution that handles a lot of students, but instead actually proportionally it was going to pair schools, other for-profit places of education. So we did this work, we spoke with experts, who verified our findings, and then started explaining to our readers and viewers about how more money was going to for-profit schools. We did things like some of the money was flowing out through the Department of Education. And in that case, we did need to file a Freedom of Information Act. I think we were the only news organization to do that. And what we could see there was that a lot of money was going to big agri businesses and very little was going to small farmers. So we got those records and did the work to go and sort through who was receiving those monies. And then of course, the big program was the Paycheck Protection Program. And that's the money that was designed to go to small businesses to help, our Main Street businesses get through these economic tough times. But the SBA, which is the Small Business Administration, which is part of the Department of Treasury that got the money, it was very reluctant to release that information. And that was very frustrating as journalists because in the past, it's been really clear under US law that when the SBA does give out money to small businesses, that's public information. The name of the business, the number of workers, the amount of money we're talking about, all of that is very public information. And the Treasury Department last year was saying, no, we're not going to release it. But again, we as journalists, we follow document trails. So even though the Treasury was giving us a hard time and we're filing Freedom of Information Act requests, we knew that this information was going to begin to crop up elsewhere. So we kept a careful eye on Securities and Exchange Commission filings, SEC filings. Why? Because publicly traded companies, where you can buy stock in, they have to make public filings when they do things like get a big loan from the government. So we started tracking SEC filings, and sure enough, even though the Treasury Department was not releasing this information, we could see well-heeled, well-to-do, publicly traded companies getting government loans, sometimes $10 million, sometimes even more. So we were seeing some of the big loans that were coming out. We could see businesses and billionaires beginning to get this money by tracking these kinds of filings. We could see companies that had connections to the Trump administration getting big loans. We could see companies like Shake Shack that we wrote about and others wrote about, and they were essentially shamed when their loans were made public, and they started returning money to the federal government once their big loans became public, because of course they had access to Wall Street. They could go and get a lot of money through issuing stock. They were not the kinds of companies that senators and congressmen and Treasury Secretary Mnuchin and others were saying, needed to get Paycheck Protection Program loans. So this kind of inequity and seeming unfairness was one of the things we began exploring. But of course, we wanted to get all the loan records because we knew that they were public. So we at NBC, along with the Washington Post, the New York Times, a bunch of other news organizations, I think about a dozen in total, we banded together and we sued the federal government to get the records so that we could report to the public about who was getting Paycheck Protection Program loans. So we sued, and relatively quickly, we won in federal court. I think by October, November or so, a federal judge ruled in our favor. And then in December, we actually got those records. So is one of our stories about a judge ordering the Trump administration to release these records that are tried not to put out. And then once we got those records in early December, we just began working around the clock to go through them and see what we could find in them. And among the early things that we looked at was whether people at Trump and Kushner properties, Jared Kushner, if you don't recall, was a senior White House advisor to then President Trump, and both of them had vast real estate holdings that they were still holding on to directly. So we wanted to look at who was getting the money, and it was essentially combing through the addresses of the loan recipients, and we could see that there were a lot of tenants in Trump and Kushner properties that were getting loans. And of course, why does that matter to the White House? Well, if tenants in their properties were getting Paycheck Protection Program loans, that means that then Kushner and Trump didn't have to worry about the rent being paid. The rent was would then go right to their businesses. So other times, in other businesses, rent checks were not being mailed off because the finances were so tight. But that was not the case in Trump and Kushner owned properties. We spoke to a lot of sources to do our stories. We spoke with members on the House Select Committee to handle economic relief. We spoke with the Inspector General, an agency inside the SBA. We spoke with the Congressional Research Service, which is a very sober, analytical part of Congress that can really get into the details and explain things for us and for the public. The Government Accountability Office was also very helpful, and the Justice Department was beginning to prosecute fraud cases. So we kept track of all these things. We spoke to a lot of experts. One of the areas we found was a big problem was that the way the SBA set up this program, this loan program, unlike other SBA loan programs in the past, was that instead of having any kind of due diligence occurring that might take, as little as 24 or 48 hours, instead of having that kind of due diligence where a bank or someone else would have to vouch for a loan applicant, instead, the SBA put together a loan application form that just essentially relied on the word of the company seeking the loan. So that was really interesting, because if you're just relying on an applicant to that we're just going to take their word, as a country before we give them, perhaps millions of dollars, if the loan applicant had committed fraud in the past, it doesn't take that much of a leap of logic to think that, well, if they committed loan fraud in the past, or some kind of fraud in the past, maybe when they're filling out this application, they'll just flat out lie and just say, nope, never been in any trouble, never had any kind of bad things happen in my track record. So this is the actual loan application form. And we would read documents like this. It's only a couple of pages. It's not a long document to read. And in, bureaucratese, what they wrote here was, is the applicant presently suspended or debarred or ineligible for getting any kind of federal loan or grant, or involved in any kind of bankruptcy? And what we found, shockingly, is that there were businesses that actually were debarred from doing business with the federal government, that actually were in trouble, and yet they still got loans. And we were able to find millions in loans. We think that, perhaps more than $100 million in SBA loans went to companies that were banned and seemingly broke the law when they filled out their loan application form and said that they were not in any trouble. We also found others were getting Paycheck Protection Program loans that, maybe we're not breaking the law, but, it's a little unseemly, that they were getting loans. So there are hate groups identified by Southern Poverty Law Center and other organizations. There's not a long list, but it is a list that you can comb through. And we were able to identify at least 14 hate groups that were getting Paycheck Protection Program loans. We were able to look and see that some of the biggest churches in the country, that did have a lot of reserves that, were mega churches, that they were getting Paycheck Protection Program loans. We were also seeing that some corporations, the way they were getting around the $10 million cap on loans was by having the loans go to different subsidiaries. And then, of course, we also saw things like economic disparities, where a lot of these Paycheck Protection Program loans were going to well-heeled communities that were predominantly white, predominantly richer, rather than lower income communities of color. So that's some of the work that we did. And we also did work beyond just the CARES Act. So the federal government had a program called Operation Warp Speed, where it was trying to contract with companies that would help, get vaccines out there, help distribute vaccines. There was a spectacular fail by one company. You may recall it was Kodak, said that it was going to help provide chemicals that would help get out vaccines to the American public. And of course, Kodak doesn't really have a track record in working with pharmaceutical chemicals. And also its executives began trading stock the second the loan, shortly before the loan became public. So when the loan did become public, Kodak's stock prices escalated and there was questions about insider trading. So the Kodak story was a pretty spectacular example of a government loan to a company going wrong. But we started thinking, well, if it happened to Kodak, why wouldn't it not happen with other companies? And there was a company we came across called Apiject, and it promised to make syringes. The Trump administration very quickly arranged for a series of contracts through HHS and through the Pentagon. So this company got a lot of government contracts very quickly, and it also got a big loan arranged through the U.S. International Development Finance Corporation. And what's interesting about that is the U.S. International Development Finance Corporation is a kind of an independent agency offshoot of the State Department, designed to help relieve poverty and encourage businesses in poor countries around the world. It's never really been in the business of doing domestic lending, let alone domestic lending to help, pandemic relief efforts. So it wasn't really built to do this kind of work, but yet it lined up a massive loan to help Apiject. So that was kind of interesting too. But not to bury the lead, here's the interesting thing about Apiject. At the time that all these government contracts were lined up and this big loan, government-backed loan was lined up, Apiject did not have a syringe that was approved for release on the US market. So it was getting all this money, and yet its syringe was not yet approved. And I believe even today, it's not yet approved for use in the United States. So we did the story about, how up to 1.3 billion in loans and contracts had been teed up for this company. And yet, it's still not, the American public still has not seen that syringe being used to deliver vaccines. And even more, we had a lot of experts who said that, syringes was not our problem. Getting vaccines was a problem facing America, but actually syringes was not something that was a big problem. So those were some of the stories we did as far as pandemic relief and covering the pandemic. And we continue to do stories today that are a little bit more of an investigative nature. But I know that, I think some of you know that in addition to doing my own stories at NBC, I also teach at CUNY. I think Laura was kind enough to mention that. So this is pandemic related, but I'm really proud of my students' work here. This is a story done a little more than a year and a half ago by Abigail and Harsha, two students of mine. And one of the things that they did is they wanted to look at the mental health crisis facing college students around America. And again, the way we go about doing investigative work, and this is the painful thing my students learn every fall semester, is we do a lot of drudgery. We go through a lot of documents. It can be sometimes very boring, but the students wanted to look at mental health on college campuses, and the way they looked at it was different than the way most people have looked at it in the past. I had them go through US Department of Education records about times when colleges essentially failed to properly help with the mental health of students. And so we examined a lot of US Department of Education documents, and they did this story that showed how colleges were falling short. And this story then, because of the pandemic, right before we were getting ready to publish, of course, the pandemic was unfolding. So we made sure to tie this in with the pandemic, because mental health on college campuses during the pandemic became a big issue. And this story kind of related to that. So if you go here, this is the story that they did. If I can read the top of it, you can see a little bit about how we structure investigative stories. Even though we go through a lot of documents, do a lot of detailed work, we want to make sure that it relates to, that people can relate to it, that we can understand the humanity and the people behind these stories. So if I may just indulge me to begin reading this, Lu Chang Wang was supposed to graduate from Yale University in 2017 as a sophomore. She struggled with mental health issues. She enrolled in classes and then had taken time off to deal with her struggles. Now she feared that if she took another break, she would never be allowed back into the college that she treasured. "Dear Yale, I loved being here," she wrote. "I only wish that I could have had some time. I needed some time to work things out and wait for a new medication to kick in, but I couldn't do it in school. I couldn't bear the thought of having to leave for a full year, or of leaving and never being readmitted. Love, Lu Chang." This passage would stand as her suicide note. No one knew where she was in the hours after she posted it. She had flown back home to California and then apparently jumped off San Francisco's Golden Gate Bridge. She had not been the only student at Yale who felt pressure over whether to seek mental health care or risk being allowed to continue their studies. And Yale is far from alone among universities facing this issue. Americans' teens and young adults report record levels of mental health issues, and college counselors are reporting ever-increasing demand for their services. The demand has only escalated with the coronavirus pandemic. And we go on to quote some statistics, and then we go into this part here, which is what we call in journalism the nut of the story. Yet even in the best of times, when students have direct physical access to college resources, universities have had difficulties providing mental health services to their students. Filings with the US Department of Education's Office of Civil Rights show more than 50 substantiated cases in the past 5 years in which universities fell short of federal law when it came to helping at-risk students. At universities across the nations, leave of absence policies have been found to discriminate against those with mental health disabilities, public records show. Federal filings show professors ignoring required accommodations for students with certified special needs, universities not having enough staff to help with those with mental illness, and schools not providing counseling for victims of such sexual assault, a population that is particularly susceptible to mental health problems. So then the story goes on to describe other examples and other issues relating to this and going through other cases. I bring up this story because several months ago, we were pleasantly surprised to learn that Abigail and Harsha got the Investigative Reporters and Editors Award for Best Student Investigation in the country. And it's, I think, the 4th time my students have won that award. And I'm very proud of my students and their work. They've been finalists several times and they've won as well. And that's probably the highest award that students can get for investigative reporting. And I'm really proud of them. So I just wanted to highlight that story as well. So anyway, I hope this has been helpful. I have a couple investigative projects that I think come out in late November or early December, and I'd be happy to talk more about those. But this is a little bit about how we go about doing investigative reporting, even when there's a big crisis occurring in the country, and also a little bit about how we try to pay it forward and, and teach students about how to do this work. So I know that I've rattled on for about 45 minutes or so, and I'd love to take questions and hear what people are thinking or whatever it is you may wish to ask about. So Laura, I don't know if it's a good time to do that.
Yeah, it's great. Thank you so much, Andy. That was fascinating to hear how the sausage is made. I think it's really fascinating, especially how you focus so much on where the money goes. That was really interesting to me, hearing about that.
Yeah.
And really, God, I'll just start with the questions. One of my main questions is, how do you protect yourself from just overwhelming cynicism as you're working on some of these stories? I mean, just hearing about the CARES Act and where the money was like, I felt overwhelmed with cynicism.
Yeah.
I was wondering, like, how do you do that as a journalist?
Well, I mean, we always, when we do stories like this, when things work out well, the stories do have an effect and they do have a change in policy. So you do see government leaders, listening to these stories, reading these stories, asking about these stories. So for instance, like with the CARES Act, yes, the SBA was denying us records. Yes, we had to go into different corners of public records to document misspending. Yes, we had to take the time and effort to sue not only file Freedom of Information Act requests, but then sue the government, and again, it's all these news organizations banding together to sue, and then winning the release of that. One of the upshots is that the SBA in the past few months has actually tightened the rules. So hopefully, we'll go back and check, but hopefully the ways that you could commit fraud are less likely to occur, and it's clear that legislators and the agency were reading our stories, not just NBC, but others, they're reading our stories and they're like, right, this is something we know how to fix. We can fix this. So I think when your stories have an effect, it does make you, it's like, okay, we're doing this, but we think there is a public good. The public has a right to know, and that maybe policies might change.
Yes. Yeah. What you're doing can actually enact change, which is great. When you're receiving the stories, I think it's a different.
It's heartbreaking, when you're having these like midnight conversations with doctors or nurses about, their lack of protective equipment, and they just feel like, the hospitals or their local government just doesn't have their back. I mean, those stories are absolutely heartbreaking. And, I think whenever I hear people complain about like, oh, why should I get vaccinated? I always go back to thinking about those doctors and nurses who, can be so overwhelmed dealing with something that might be avoidable, and, those voices are so passionate,
Right. Does it seem like the system is better prepared for like a next time at this point, or do you have any sense of that after?
Yeah, I mean, I think like the tendency of setting aside the rule book on how you can go about dealing with pandemics, I think people have realized that, we shouldn't set that aside, that should be properly funded as a government. And clearly there are a lot of people from past administrations who, are lending their voice to say, this is something we just have to keep being prepared for. So,
right. That's good.
Yeah. Like one of the things that's like in the past version of the rule book was like not to have politicians give out health pronouncements, to always just have that medical professionals do that. That's kind of what we did during the SARS epidemic and the MERS epidemic. And the reason why you want health professionals doing it is that if you have politicians doing it, a viewer or reader might say, oh, that's the person on my team or not the person on my team, and have a political reaction. Whereas if it's a more sober medical professional, people might be more like, oh, this is medical advice, it's apolitical.
Right.
And so,
right.
you know, that's the advice that we've done in the past. We obviously didn't do it for the pandemic, you know, the current coronavirus pandemic. And there's, you know, I think that's like an example of what's in the rule book that you could have followed that wasn't followed.
Right. Right.
Yeah.
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 May I have Shirley Gordon? I'm on the phone. To follow up, I was thinking about the same as Laura did, as far as the consequences of all of your work and all of your investigations, like in Paycheck or in the suicide, the health of college students. And so how are you feeling that your work has helped or not been responded to?
Yeah, so I guess it's a little bit like the Serenity Prayer. I forget exactly how that goes, but you know, what are the things that you can control and the things you cannot control? So we obviously have no idea what effect any of our stories may have when we do them. You know, sometimes your stories have no effect. Sometimes they have far greater effect than you might imagine. You know, we do look for stories, you know, that involve people's lives, that, you know, that where there are consequences and the public has a stake in the issue that we're reporting on. So, you know, we sometimes do think like, well, if we do this story, maybe it might have an effect, but you can never take that to the bank. So, you know, I worked on a series of stories back at the Times where we looked at like the Long Island Railroad. We heard rumors that there were train conductors there taking advantage of their disability pension system. And we filed a bunch of FOIAs, and we were able to show essentially that, you know, the Long Island Railroad, according to its disability pension filings, might be one of the most dangerous places to work in America, you know, more dangerous than mines, more dangerous than even freight railroads. And those stories essentially led to a government inquiry. It led to prosecutions. It led to people being put in jail. You know, you know, that effect does not happen every day. You know, one of the things that's kind of amusing, by the way, about all of that is that while it led to all these arrests and these government inquiries, it didn't win a single journalism award. So that was kind of hysterical. You know, we did other stories that like looked at, you know, that looked at tainted chemicals being manufactured in China and they were unregulated. They were being shipped abroad to be put into pharmaceuticals, and it led to the deaths and injuries of scores of people. And you know, that story won a Pulitzer. I think it might have led to some policy changes in China. You know, there was some overhaul in the system. So stories do have effect.
Good.
You know, other stories don't, and you just don't know. You never know really what will happen.
Well, I wanted to tell you that PBS had highlighted your two students in a short session. I saw it last week. I was most impressed with that.
Oh, great. So, I didn't know about that. I'll have to check that out. That's great.
Do that.
Did you say it was on PBS?
Yes. It was on, you know, the channel 13, 7 o'clock news.
That's great. I had one student, she came from Finland, but she was passionate about the nutrition and the food being served in New York City schools. And she was, you know, we started digging into it, and eventually the story led to examining health inspection reports for school cafeterias for all the New York City schools. And she did that story. The story, you know, it allowed parents in New York to look up all their schools. But the upshot of the story was that, you know, essentially almost, you know, 1 out of every 2 times when health inspectors go in, they find, you know, unsanitary conditions, you know, 1 out of every 4 times they find the conditions are so severe they could lead to food poisoning and foodborne illnesses. We documented cases of foodborne illnesses. They published that story. That story went viral. It was picked up by, WNYC. It was picked up by all the local TV stations. It was picked up by the Daily News and New York Post. So it's kind of, and the mayor promised reforms. So it's kind of neat when your students actually get to have a taste of that.
I do know that, being a teacher, what pride you have in what you do.
Yeah, well, thank you for being a teacher. We need good teachers out there. It's
I'm
great.
long retired, but interested.
Yeah.
Were there any other questions for Andy? I have one if nobody else does, but give somebody a chance to interrupt. Well, Andy, I was wondering, what do you tell your students about working as a journalist today in this climate? I mean, ever since the whole idea of like fake news came about, it seems like your job became a lot harder and more complicated.
Yeah.
And I was just wondering, like, how do you talk to your CUNY students about that?
Yeah, I mean,
prepare them, I guess.
Yeah, I mean, there's no doubt that you can have people say stuff at you, and I've seen that happen throughout the years. It probably is worse now, but I think like whether it's things like what we're doing here is just explaining that, like, look, we're just going through. We're following the money. We're going through public records. We're going through documents. This isn't about whether you're a Democrat or Republican. This is where the facts lay. And
right.
And part of what we do when we do investigative stories in particular is we try to include enough information without boring the reader or viewer, of explaining the kind of due diligence we went through to do this story. That we're not just like,
right.
We didn't just speak to 2 people who were talking smack and like throwing it together and calling that a story. That we're trying to like explaining detail, like, this is what we think we know. This is how we came across what we think we know, and how we gathered that information, so that the public, when they read our stories, can hopefully appreciate what went into making it. And we have our students do that so that hopefully they will do that with their stories. There's no doubt journalism, like so much of our society, is changing with technology and so much. And, I hope that, maybe their dreams won't be to go work at the New York Times or some big television network. That'll be to work at some, dominating news website like BuzzFeed or wherever their career may lead, that they kind of bring that sensibility to their journalism.
That's great. Great. Thank you so much, Andy. That was really insightful and interesting. It's great to have you.
That's my pleasure. I hope this wasn't too much and about
Not
how
at
the
all.
sausage was made, and I hope it was.
No, it was fascinating. It was really fascinating. Thank you so much.
It's my pleasure.
And I just want to remind everyone that next Friday we have Professor John Wargacki from Seton Hall coming, and he will be talking about the phantoms of poetry and prose for Halloween. So,
perfect.
Join us. Thank you all so much. Thank you, Andy, again, and thank you for everyone who's here.
Have a great week, everyone.
Okay.
Thank you.